Dr. Cohen talked about with the lower extremity overuse injuries, how there are extrinsic and intrinsic factors, and the extrinsic factors, like she talked about, are turf versus field, equipment, the sport you play, the weather that the sport is played in. You can't change those, some of them you can, but for the purpose of this talk, health professionals, physical therapists, athletic trainers, where we can make a biggest difference in reducing these risk factors are probably right there in the modifiable intrinsic factors. The non-modifiable being that their age, their sex, and the fact of if they have a previous history of injury. We can't change that. But the modifiable factors being their strength and their overall conditioning, their flexibility, and their muscle balance, we can do a lot about that. So we're going to talk a little bit about those exercises and stretches that can change those risk factors. Now, Dr. Sethi has already talked about a lot of shoulder injuries. Obviously, there are acute and traumatic injuries in the field of pediatric sports, fractures, dislocations, strains, and sprains. But where those modifiable risk factors come most into play in reducing injuries in these overuse injuries: rotator cuff tendinopathy, instability, stress fractures, little league shoulder, which is a fracture of the growth plate in the shoulder. These are injuries due to repetitive overuse, okay? Where we see this most often, or at least I do in my practice, you have your throwers, your pitchers, your tennis players, swimmers, and quarterbacks. So there you go. And there's kind of a similar motion across all 4 sports. And we'll talk about them in a little bit more detail. So like Dr. Sethi talked about, the kinetic chain is important. If you're talking about injury prevention of a shoulder injury, you can't just talk about the shoulder. You have to look at the whole body, whether it's a pediatric or an adult athlete. Tennis and baseball are somewhat similar. I mean, the overhead, the rotational throw is very similar. You start with a fairly flexed position, and the force is generated in the legs and the core, and then transferred to the arm. They start kind of flexed, and I think of it as an elastic. You start scrunched up, you pull it all the way into an extended, lengthened position, and all that maximal energy that you produce is then transferred to the ball, the racket, the football, and the amount of force you produce is directly going to affect the performance and how fast or velocity of the ball or the serve. The transfer of the force goes from the core and the legs up through the shoulder. There are major power producers of the shoulder: the lats, the deltoids, the pecs. You have your scapulothoracic musculature, your rhomboids, and your trapezius. But they're just, again, they're absorbing that force and transferring the force to the arm. And in the middle of all this and underneath all of that are your static stabilizers and your dynamic stabilizers, like Dr. Sethi spoke about. And this is where we want to work on to help prevent. These are the structures that usually get injured. You don't see too many people coming in with a deltoid strain, although they'll come in and say my deltoid hurts. They don't have a deltoid strain. It's usually the rotator cuff or the labrum or these underlying stabilizing structures that are getting the wear and tear over time because of possibly poor conditioning and those modifiable risk factors. We have to understand as health professionals the role of the static stabilizers, the rotator cuff in particular, the scapulothoracic muscles. They decelerate the arm, like Dr. Sethi said. That's why our arms don't fly out of our sockets when we're decelerating all of that force and energy production that we just did with every pitch over and over. And they're all very similar motions: a tennis serve, a quarterback throw, a pitch or a general throw. They start flexed, they extend, all of that energy is produced and transferred to the ball or the racket, and then they have to decelerate their bodies, and not just at the level of the shoulders, but all the trunk muscles, the hip muscles, the hamstrings, all of those eccentric stabilizers and decelerators are working pretty hard to make sure that the performance stays on par. Swimmer's shoulder is a little bit different. Obviously, first off, the big difference in a pool, you're non-weighted, so the forces are completely different. But you're still producing large amounts of force and torque through your shoulder through an entire range of motion. We still see a lot of demand on the static and dynamic stabilizers. We see rotator cuff tendinopathy. We see a lot of instability in young swimmers. But even though it's non-weighted, they still use their hips and their core to generate that force. And excessive laxity and stability on the joint capsule can then lead to more rotator cuff tendinopathy, and they tend to go hand in hand in swimmers. And again, because even though they're non-weighted, their hips and core play a huge role. So in any of these young athletes, the throwers, the tennis players, the swimmers, you have to look at the whole body, the whole kinetic chain, and make sure everything's on point to prevent injury. So we've talked a lot about the intrinsic risk factors, the modifiable risk factors, strength and conditioning overall, but we've talked a lot about it's not just shoulder work that you have to do to prevent shoulder injury. You have to look at the hip, you have to look at the core, you have to look at the trunk, the strength, the mobility, the overall flexibility. Okay, so all of this plays a role in preventing injuries in our young athletes. So some of the things that we look at in our examinations, we'll put them in prone. We look at hip rotation right there. Limited hip rotation. If you imagine a pitcher with their leading leg, their stride leg, when they hit the ground, they're not going to be able to hit the ground pointing to home plate if they don't have enough hip and pelvic and trunk rotation to do so. And what is that going to do? That's going to limit the amount of force they produce, but potentially, in order to keep up the accuracy and the performance, they're going to overstrain something else, like their growth plate and their humerus. So we look at rotation and prone, we look at their core endurance, have them do a plank, have them do a side plank, test it. Can they hold it for 90 seconds? In the literature, it's been established that 90 seconds is a good normative value. I can't even do 40 seconds, and we're expecting our young athletes to pitch over and over, and overhead sports and tennis players, they should be able to do a plank for 90 seconds if you want to help prevent injury. Look at their hip flexibility, their hamstrings, little tight hamstrings down there on the corner, hip flexion, flexibility, their lumbar extension. In a pitch, there's so much lumbar extension, and in tennis overhead, tennis serves, there's a lot of lumbar extension involved. So if they can't do a prone press up and keep their hips down, they're at risk for injury potentially. So how do people present? You know, that top left corner, that left scapular inferior angle poking through right there, that shoulder blade, that just general postural assessment, you can see right away that that shoulder blade's tilted forward. They're not necessarily going to get that good stable base, and they risk impinging their rotator cuff, the labrum, the anterior structures of the shoulder, because that shoulder blade might not get into position. And what we see is just a tight musculature, the pectoralis, anterior musculature causing that tilt in a patient. The next picture, lower trapezius. How strong is their lower trap or their serratus anterior? Those are two primary shoulder blade stabilizing muscles that will help keep that stable base when someone's about to serve a tennis ball, hit an overhead, throw a baseball, throw a football. But also in swimmers, because they're not throwing anything, but they're producing force through the entire motion that they're swimming. Clinically, they present how strong is their rotator cuff. Do they look unstable? I mean, Dr. Sethi went through some of the examination signs of instability in rotator cuff. So those are things you want to look at when you start to examine a patient who's injured. You're looking at the whole body. You're looking at strength and range of motion mobility. So strengthening exercises, this is where my job gets really easy, because this has been established for years now. The Throwers 10 is a really good protocol that's been around for at least 20 years. And on the ONS Foundation website, we have about 17 or 18 pictures. It's been modernized, it's been adapted. It can be used in young athletes, prepubescent, adolescent athletes, even adult athletes. And it focuses on strengthening the shoulder blade muscles, the rotator cuff, not only that, but also the hips and the core. It uses a little bit more modern equipment than just the Throwers 10, 20 years ago. So without going into all of those pictures, the website that we have is a really good resource for you. But also on that resource, because when I give this lecture, I get a lot of questions about pitch counts. But on the ONS Foundation website, you'll see a lot of information, the latest research on pitch counts, what pitches can you pitch at certain ages to help prevent shoulder injuries. But what the Throwers 10 doesn't go into are the hips and the core that much in general. So I like to throw out some hip and core and dynamic strengthening exercises that you guys can take notes on if and when one of these young athletes comes across your practice. These 4 exercises, lunge squats, side lunge squats, regular squats, and one-legged squats, target every single muscle from your hips down to your toes. Those 4 exercises, 2 sets 15, like we talked about in the resistance training lecture, a couple times a week, and they've actually been shown in the evidence to help reduce risk of injury, not only in throwers, but also in, obviously, soccer players. Stretching. Stretching is important. We talked about in the strength training lecture, cool down, stretching are very important when it comes to reducing injury. We have chest stretch for throwers, a posterior capsule stretch, triceps and lat stretch, and then hip stretching. There's a lot of hip stretches that you can do, but I just wanted to put that one picture because it targets the adductors and some of the rotators that tend to be tight. Dynamic functional training, or plyometrics. You can throw a dog down, and you can definitely chase a dog around the floor, but fortunately, we do have some technology and equipment available these days, and especially in this area. I would love to tell a parent, just let your kids go play in the backyard, and I do sometimes, and they look at me like I'm crazy. But if they are going to go to a pro sports or someplace where they're going to do some off-season conditioning, then we want to make sure that they're doing some rotational components to their conditioning, some trunk movement. That first picture is a picture actually doing a yoga move where they're in a lunge position, which is a perfect replica of the stride position of a pitch, and yet rotating and mimicking that deceleration position. Getting on a BOSU and challenging your whole body and incorporating stabilization, strengthening. And that bottom picture is a TRX, just another modern piece of equipment that we use for strength and conditioning, the core and the whole body, making it functional and dynamic. And general guidelines for young athletes, the American Academy of Pediatrics, again, that Council on Fitness and Exercise, they actually post these guidelines on their website. And I think it's an amazing resource for all healthcare practitioners who see young athletes. But at least 1 to 2 days of rest, at least 1 to 2 days. That doesn't mean that they have to sit down and play video games all day, but those are the days where they should be playing baseball with the kids in the street, maybe not in the street this time of day, but in the backyard, or at the local playground or at the local park, okay? Those are the days off from competition, not just for physical rest, but also mental rest. And resting at least 2 to 3 months out of the year. Probably one of the biggest things you can do to prevent a shoulder pain and injury in a young athlete is tell them stop pitching for a full year. Stop pitching 12 months out of the year. Stop playing baseball 9 months out of the year. Go play soccer. Give your arms a break. Avoid early specialization. Do not play through the pain. That's the big one, okay? Strengthen 2 to 3 days per week as part of that preseason training. This can be your month's rest where you focus on injury prevention and you focus on just developing overall core strength and conditioning, shoulder and leg strength and conditioning. And 1 to 2 days per week are needed for maintenance during the season. And finally, always incorporate dynamic warm-up and stretching cool downs in your athletic competition. So that's it.